I'm Dr. Sovereigns from Countryside Veterinary Clinic, and today you'll find us in the laboratory, in-house laboratory of our veterinary hospital, and Minnie's going to ask me some questions so I can better explain to you why we do lab work and how we do lab work.
Great. Dr. Sovereigns, how does a baseline lab test benefit the health of my dog?
When you do a baseline or an early detection blood work, you're looking at what is normal for that particular dog or cat at that particular time, so that if your animal is ill, we already have some normal parameters and we can determine if it's off.
What different types of lab work are there, and how are these tests done?
I kind of break them down into four basic parts. You have fecals, which are stool samples that we send in on dogs who are looking for intestinal parasites generally. We have blood work, where we take blood and send it in for CBCs and chemistries, and we can determine kidney disease, liver disease, anemia, diabetes. And then we have skin cytologies. This is lab work that's done by maybe taking a slide and over top of a skin lesion or bacterial infection on the skin and putting it under a microscope. And then the fourth one that I think of is urine samples. So sometimes we collect urine from dogs and we put them in our urinalysis machine here, and we can have the answers back in moments.
And what do the chemistries mean on my dog's blood work?
So we do say that a lot. We say CBCs and chemistries all the time to owners. So let me break it down for you. A CBC is a white blood cell count, a red blood cell count, and a platelet count. A chemistry tells us about the kidney function, liver values, our blood glucose, total protein, electrolytes, and all of those types of, and thyroids. So we can tell you about the health of your pet.
And why might my dog need lab work?
Lots of reasons. All day long we run lab work in here. This is a CBC and a chemistry machine, a urinalysis machine. We spin down things and we can do blood work on here. It's very important for dogs that are vomiting to see if they're dehydrated, if maybe we can tell if they had a toxin, maybe they're in kidney failure or liver failure. We do it for dogs that have weight loss, vomiting, diarrhea, let's think what else, fevers. And we also do it, of course, when it's normal, sometimes just to get our normal values. And we also use it if you're on medications to make sure you can stay on that medications. And sometimes we can actually measure the medications. Like if you're on phenobarbital, we can measure phenobarbital levels and make sure you're on the right dosage.
Why is the early detection and diagnosis of dog illnesses using lab work so important?
I think the sooner we find out what the problem is, lots of things will happen. The owners will be happy because we have a diagnosis and we have a treatment plan. The animal will be happy because we know what's going on and we can specifically treat them. And then the outcome is always going to be better if you can find it right away and get better. We're going to have better results when you do that. All right, so thank you for watching this video. If you have any questions, you can call Countryside Veterinary Clinic, and I hope that helps you understand how and why we run blood work every day.